What do we mean by hives or urticaria? Red, raised and itchy rashes on the skin surface are called hives, which are mostly triggered by allergens. Anything which produces an allergic reaction is called an allergen. It is also called by other names including weals, welts, urticaria or nettle rashes. An allergic reaction is always followed by the release of a protein by a body called histamine. As soon as histamine is released, the small blood vessels i.e. capillaries leak fluid. This fluid accumulation in the skin is the main cause of rashes. At least 20% of people are affected at some point in their lives by hives. These rashes are not contagious. Causes: the body releases histamine and other chemicals from the inner surface of the skin as a result of reactions by allergens, which give rise to hives. The histamine and other chemicals cause fluid accumulation and inflammation under the skin, which leads to weals. The following are the known triggers of hives. Medications, such as selective antibiotics and NSAIDs, i.e. non-steroid anti-inflammatory drugs, for instance, aspirin and ACE inhibitors, which are used in high blood pressure. Foods which include nuts, shellfish, additives, strawberries, wheat, and egg products. Various infectious diseases e.g. influenza, glandular fever, hepatitis B, and the common cold. Urinary tract and strep throat bacterial infections. Various intestinal parasites. Extreme hot and cold or extreme temperature changes. Higher than normal body temperature. Pet dander shed by cats, dogs, horses, etc. Cockroaches and their waste materials. Latex. Pollen. Some plant species including nettles, poisonous ivy, and oak. Insect stings or bites. Few chemicals. Chronic diseases, for instance, lupus or disease of the thyroid gland. Exposure to sunlight. Exercise. Intense scratching. Water on the skin surface. But patients fail to figure out the cause in almost 50% cases. Chronic urticaria is an autoimmune disorder, but the reason for this is not yet discovered. Treatment. The regular consumption of non-sedating antihistamines for several weeks treat acute urticaria. Antihistamines, including fexofenadine and cetirizine, blocks the adverse effects of histamines, thus inhibiting rashes and itchiness. Most antihistamines are available online and in pharmacies. Antihistamines can cause drowsiness, especially in alcohol addicts. Some are prohibited for consumption in pregnancy, except when prescribed by a doctor. Patients suffering from angioedema should see an allergist, an immunologist or a dermatologist. Serious breathing difficulties can result from angioedema. In case of swelling of tongue or lips and breathing difficulties, doctors usually prescribe an epinephrine auto-injector. For instance, EpiPen is prescribed in emergency conditions. Patients should try to avoid triggers. Chronic urticaria. Chronic urticaria can lead to long-term discomfort and complications. Its treatment is different from that of acute urticaria. Antibiotics, e.g. dapsone, are used to reduce swelling and redness. An injectable drug called Xolair, or omalizumab, functions to block immunoglobulin E, a substance that helps in allergic reactions. This drug inhibits the symptoms of chronic idiopathic urticaria, another type of hives that has an unknown origin, lasting for months or years. Patients experiencing severe symptoms should see a specialist. A special treatment method called acupuncture can treat hives. A systematic review was published in 2016 that stated, acupuncture may prove effective and safe for relieving symptoms of chronic urticaria, which was based on low-grade evidence. However, the authors demanded to confirm findings. Severe discomfort can be caused by chronic hives, which can increase the possibility of depression. Stress can worsen hives, thus starting a vicious cycle. It is better for those patients who are experiencing depression to consult a doctor. Symptoms: various rashes appear on the skin in the form of swellings or weals. These swellings appear as round to oval bumps, which are either red or pink. Their size varies from few millimeters to several inches. A red flare circles these itchy rashes. The weals are mostly present in batches, most frequently they appear on the face or upper or lower extremities, e.g. arms, legs, hands and feet. Welts do not last longer than 24 hours but expect the appearance of new ones. Either their occurrence is limited to one part or they scattered in different parts of the body. Symptoms do not last longer than 24 hours, but in some cases, a new weal follows the last one. Sometimes, hives can last longer than several days. People suffering from chronic hives continue to exhibit symptoms from days to months. Anaphylaxis. Severe allergic reactions that can affect the entire body is called anaphylaxis. Breathing difficulties and general loss of consciousness are one of the leading causes of anaphylaxis. It must be treated right away as it is fatal. Anaphylaxis is a major medical emergency. If the patient encounters the following symptoms, then immediate treatment is necessary. Nausea plus vomiting. Breathing difficulties as an outcome of swelling in the floor of mouth, lips, tongue or throat. Cold and clammy skin. Increased heart rate. Faintness and dizziness. Anxiety attacks. Patients with hives can experience other symptoms which are an indication of anaphylactic reactions. Home remedies. Although triggers do not cause any complications, they worsen the symptoms, so it is better for patients to avoid them after identification. This includes, either inhibit or limit alcohol consumption. Avoid specific medications. Avoid stress, use meditation, and relaxation techniques if needed. Use mild detergents, soaps, and skin creams. Avoid those food substances that trigger histamine production. These include spinach, yogurt, tomato, fish, strawberries, processed meat, and chocolate. Use the following tips to reduce irritation: wear loose and lightweight clothes. Do not scratch rashes. Use soaps if you have sensitive skin. Consider taking a shower or use lotion, fan or cold water to cool the area. Try taking an oatmeal bath in tepid water. Identify and avoid triggers. According to some sources, supplements can be utilized such as vitamin C, D, evening primrose oil and quercetin. There is a possibility of adverse effects of these supplements, so it is better to consult a doctor before their consumption. Keep a complete record of flare-ups as it proves helpful while identifying a trigger. Hives and stress. Emotional stress can cause hives and even worsen its symptoms. An experiment conducted in 2005 stated a link between insomnia, low family support, continuous stress and hives in almost 75 cases. Our scientists also strive to explain how chronic stress dysregulate the mediators or aggravate the pathophysiology of an underlying inflammatory disorder. During stress conditions, inflammatory reactions are more severe in those patients who are suspected to show reactions. This means hives have a strong link with stress. Types. Hives are of two types: C, E acute or chronic. However, the most common one is the acute one. Symptoms disappear within 6 weeks. Their symptoms are visible mostly on face, neck, fingers, toes and external reproductive organs of males. Although they can affect any part of the body. Chronic urticaria lasts usually longer than 6 weeks. The odds of occurrence of chronic urticaria is 1 in 1,000 people. Although the exact cause is not known, there is a possibility of its link with the immune system. Viruses can act as a trigger for hives. Sometimes, underlying autoimmune diseases e.g. lupus or thyroid-related diseases are linked to it. There is a possibility of occurrence of angioedema. The effects of angioedema are same as that of hives, but they affect deeper layers. Diagnosis of urticaria is based upon their type. Acute urticaria, examination of the rashes on patient's skin help doctors in the diagnosis of acute urticaria. You can prevent its recurrence by identifying the triggers. Doctors mostly focus on following points while diagnosing this disorder. The time and site of occurrence of episodes. Odds of an insect bite. The place where the patient works, does it have any potential triggers e.g. animals, chemicals, and latex materials? Medications or herbal supplements consumed by patients, if any. The medical background of the patient. Family history with urticaria. Mostly the trigger is unknown, but if succeeded in finding it out, you should better visit an allergy clinic. The patient's blood and skin tissues are examined in allergy clinics to find out whether he is allergic to some specific substance, i.e. food substances, chemicals, or mites. Chronic urticaria, the doctors do not recommend allergy clinics to patients if urticaria lasts longer than 6 months, as the trigger is external. The doctors conduct the following tests in case of above conditions. Blood test for diagnosing anemia. Test stool sample for parasites. Test to note the functioning of the immune system called erythrocyte sedimentation rate. Test the activity of thyroid gland, for check the occurrence of its over or under activity, i.e. hyperthyroidism or hypothyroidism. Test liver functions. Factors that can aggravate urticaria include alcohol consumption, caffeine intake, problems related to mental health including stress. Thanks for watching.